Welcome to UMCC Medical Consultant Connector, where your health matters to us. Ever wondered what a ganglion cyst is? Or perhaps you've experienced one without knowing it. Ganglion cysts are non-cancerous lumps often associated with joints or tendons, mainly in the hands or wrists. They're intriguingly common, yet many of us might not even realize we've had one. These cysts can affect anyone, regardless of age or gender, but they're most prevalent among women between the ages of 20 and 40. So you see, ganglion cysts are common, yet often misunderstood. Now you may ask, what causes these cysts to form in the first place? Well, the exact cause of ganglion cysts is not completely understood yet. However, they tend to occur after a joint or tendon injury. They could be the body's response to tissue damage, producing a sac of jelly-like fluid as a protective measure. Age and sex also play a role. Ganglion cysts are more common in individuals between the ages of 15 and 40, with women being more susceptible than men. It's also observed that people with osteoarthritis, a degenerative joint disease, especially in the finger joints close to the fingernails, are at a higher risk of developing ganglion cysts. In terms of occupation, those who repetitively stress their hands and wrists, like gymnasts or typists, may have a higher chance of developing these cysts due to the constant wear and tear on the hand and wrist joints. Hence, knowing the causes and risks can help anticipate and manage these cysts. So how would you know if you have a ganglion cyst? Well, the first sign might be a noticeable lump. This lump often appears on the wrists, hands, or fingers, but can also develop on the foot or ankle. It can be soft or hard, and its size may vary, sometimes becoming larger when you use the joint. Additionally, you might experience discomfort or pain, though this isn't always the case. The discomfort can fluctuate, and in some instances, it might even impede joint movement. Odd sensations are another sign. You might feel a tingling or numbness in your fingers or toes, especially if the cyst is pressing on a nerve. But here's the catch. Sometimes, ganglion cysts cause no symptoms at all. You might not even realize you have one until it's spotted during a medical examination for a different issue. Therefore, it's crucial to pay attention to these signs and symptoms. But how do doctors determine if you have a ganglion cyst? And what can be done about it? A diagnosis of a ganglion cyst typically begins with a physical examination. Your doctor may apply pressure to the cyst to test for tenderness or discomfort. They might also shine a light against the cyst, a process called transillumination. This can help determine if the cyst is filled with fluid. Sometimes a physical examination isn't enough. In these instances, your doctor might recommend an ultrasound or an MRI. These imaging tests can give a clearer picture of the cyst, showing its size, location, and whether it's solid or filled with fluid. Once a diagnosis is confirmed, there are several treatment options available. One common approach is aspiration, where a needle is used to drain the fluid from the cyst. This can provide immediate relief, but the cyst may eventually refill. Surgical removal is another option. This is generally reserved for cysts that cause significant discomfort or limit functionality. However, even with surgery, there's a chance the cyst could return. Lastly, there's watchful waiting. Since many ganglion cysts don't cause pain and may disappear on their own, your doctor might suggest simply keeping an eye on it. If the cyst changes in size or causes discomfort, more aggressive treatment can be pursued. Remember, every case is unique, so it's essential to discuss these options with your healthcare provider. Is there a way to prevent ganglion cysts? And what should we take away from all this? Prevention may not always be possible due to the unknown precise causes of ganglion cysts. However, steering clear of repetitive hand and wrist movements might reduce your risk. If your occupation or hobby involves such actions, consider regular breaks or using protective gear. Reflecting back, we've learned that ganglion cysts are quite common, especially among individuals between the ages of 20 and 40. They're generally harmless, but can cause discomfort or pain, especially when they press on a nerve. Diagnosis is typically straightforward, often involving physical examination or imaging tests. Treatment, while not always necessary, can range from home remedies to medical procedures. Remember, these cysts are not typically a cause for alarm, but knowing their signs and symptoms can help you seek timely medical advice if needed. Knowledge is power. Understanding ganglion cysts allows us to better manage and prevent them. Stay informed and stay healthy. UMCC, your ultimate medical consultant connector.